the most watched entertainment news magazine in the world. Beverly Hills Housewife Taylor's CAT scan.
Medical proof of the damage to her eye, shattered orbital bones. Is this evidence of abuse?
Usually a result of a fist.
Now, the first video from Nancy O'Dell's new interview inside Taylor's home.
This is the house where you and Russell lived, right?
Our ET investigation continues tonight. Just how bad was this injury?
The injury was awful. Looking at Taylor, even now, you can see that one eye is smaller than the other. When you see the photographs, you realize the extent of the injury.
The photos first shown here are powerful and heartbreaking. And how badly was she hurt? Well, now we have obtained Taylor's CAT scans, and we've taken them to New York reconstructive surgeon Dr. Barry Weintraub, who has not treated Taylor, for clues to the severity of her injuries.
She has blunt trauma to the right eye, black and blue, and a lot of swelling, making her eyelids constrict on the eyeball, such that the right eye looks smaller than the left.
Such a frightening injury. And so how close did Taylor come to being completely blind in that one eye? We will take you deeper into her telltale CAT scan. Coming up, Mark, we have more on Taylor Armstrong's revealing CAT scan. How close did she come to going blind in her battered eye? The brutality of Russell Armstrong's strike becomes frighteningly clear in black and white.
These injuries are caused by blunt trauma, usually a result of a fist.
Taylor's CAT scan photos and the world of hurt they reveal.
People can incur blindness from severe blunt trauma to the orbit.
A horrid possibility, as Taylor told me herself.
Was she worried about losing her eyesight?
She was very worried about losing her eyesight, and I know the doctor told her that that was a real possibility.
If these are indeed bony fractures, they're going to take time to heal.
Reconstructive surgeon Dr. Weintraub says that one possible injury is a so-called orbital floor fracture.
This is the orbital floor, which may have some discontinuity. The eyeball sits in a socket of bone and really has no place to go. The softest part is in the floor of the orbit.
An injury there, he says, could result in double vision.
Did she know how bad it was?
She knew when she was hit. She said it felt like her eyeball had adjusted. Her eyeball had shifted. She felt like it was in a different position.
It can affect vision. The muscles that control our ability to focus on objects are all around our eye, and if it's impacted or impinged upon by fractured bone, you may have double vision.
Treatment often requires some form of reconstructive surgery.
She would probably be really in a rehabilitative state for at least a month or longer. What the goal is at the time of an injury is to get a person really back to normal.
Another possible injury, what's called a corneal flap dislocation, has one very noticeable characteristic: extreme pain.
Oh, she said it was horrible pain. And she kept telling him that, you know, I know that you really hurt me. I'm in so much pain. And he told her she was just being a drama queen.
The cornea is only one cell layer thick and is extremely painful. Sometimes if it is injured by blunt trauma, it can cause a flap-like piece of itself, which is certainly possible with an injury this severe.
Weintraub has treated similar victims of domestic violence, a crime to which he gives a more sinister name.
Which in New York we call the hidden sin.